Hey everybody, I wanted to spend a couple minutes talking about the extrapolation posts for week 4. Um, I really like these exercises as we consider how to treat something in a remote and austere area as compared to how we treat it in our everyday practice, where everything's at our disposal, from blood work to ultrasounds to MRIs to support physicians, PAs, nurses, and so on. I mean, we definitely don't have all of that with us when we go on our humanitarian trips. So we have to consider, how would we treat, how would we diagnose and treat a condition in a remote and austere area as compared to how we treat it in our everyday practice. Love this conversation. Love the different things that you bring to light, and discussions on how you would deal with it and how you would manage the care for these patients. As you know, recently I had an event that was pretty significant with vertigo that was so severe I couldn't move for several days. Actually, it took about 3 to 4 days before I was even able to stand up with a walker, and I've been in PT since, almost like I had a stroke, retraining myself how to walk and get my balance back. It's been quite an interesting process, and one that I didn't expect to occur. And as I reflect on this, I went to the ER, I had an MRI done, I had blood work done, I had all kinds of things done in the evaluation process, and I had medications used to try to help me, and physical therapy and occupational therapy and so on. And still, at a month out, I'm still requiring quite a bit of care in my improvement process. So how would we have dealt with this if we'd been in somewhere like the mountains of Nepal or the islands of Vanuatu or similar places where there's really no medical care short of us as providers who are there to help in some way or another? And what kind of equipment do we have? We have what we brought with us. There's no modern technical type devices. There's no MRIs. There's no CAT scans. There's no ability to do any significant blood work, and so on. So we have to rely on good old clinical medicine, the medicine that requires active listening, hands-on, and diagnostic processes where we're working through situations without all modern technology and so on. So for me, it would have been interesting because you didn't have a lot that you could do to evaluate other than looking for nystagmus on the gazes and the lateral fields and the central areas to try to determine if it might be a central lesion or a peripheral lesion or something like that. And so that's really about all that we would have for something like me, vital signs, so on. And we would still have to deal with the situation. So if we had a presumptive diagnosis of something that came with vertigo, well, of course, the more probable than not thing to do would be to give an antihistamine or meclizine, and to work on the nausea through something like ondosartan, and then do Epley maneuvers and hope that this is a situation where if we can get the crystals moved, we can get things back to an equilibrium basis, and this person would be able to function normally. However, that didn't work for me. And in a remote and austere area, if that doesn't work, then what are you going to do? I mean, number one, your diagnosis is suspicious. I mean, is this an endocrine issue? Is the thyroid out of whack? I mean, you don't know. You'd have to really kind of draw blood work for that to try to determine if that was an issue. Is this a inflammatory process? Is it something like vestibular neuritis or labyrinthitis? Is there a brain tumor going on? Is it a MS or something like that? You really don't know at this point. You don't have the diagnostic ability to make that decision. So if this person is not getting better and you're out in the middle of nowhere, they actually become a problem for the team, and they're not much value in caring for those that you came to see, and they are now a patient, and you have to consider what you're going to do for them. And of course, you're going to have to try to evacuate them and get them to higher echelon care where proper diagnostic processes can be considered and treatment accordingly can be done. So these extrapolation posts are great opportunities for us to consider issues, not only with our team members, but also with patients that we might see, and how we would deal with them beyond the care that we're able to give at site when we're there. It's a good thing to think about, often not thought about, but a good thing to have in the back of your mind, and a thought process on how you're going to deal with it and how you're going to move things forward for this patient who needs higher care than you can give on site.